Welcome back. This is episode 2 of When Is It About the Patient? And we have with us today Shelley Speck. She's an office manager in primary care, has been doing this for over 25 years. And she's going to talk to us about new patient expectations, why it's important to have a primary care doctor, things you need to know when you show up for that appointment. So welcome, Shelley. Great to have you.
Thank you.
And I'm going to
Welcome,
let you
Shelley.
get the party started.
Okay. I think that from a primary care perspective, when we are preparing to see a new patient, it's always helpful if they come prepared as well. And we generally will have their records, so we get to have a little knowledge prior to the patient coming. It's always helpful to us if the patients, of course, bring your basic your photo ID, your insurance card. Those are kind of the obvious things to everyone. But it's also helpful if a patient brings their actual medications. It's quite alarming when we see medication bottles, how many they might be on a double script, especially with these mail-aways that just continue to send them to you. When we look at the bottles, you might be on two statins or two let me put it in different terms, two blood pressure medications, two different medications that are similar, one that you should have stopped, but your mail away just continues to send. So we actually prefer that you bring the medication bottles in. It's for best practice and safety to the patient. And you should already have an idea what you're looking for in a primary care. I think that relationship is going to be a very long relationship, you hope. It's not like a specialist that you may see once or twice. So I think it's important for the patient to find a PCP that they have mutual respect and trust. The doctor or APP speaks in terms and language that they understand. I think that's so important to not talk over the patient's head, or if there's any language barriers. It's important to be able to understand your PCP. It is, as I said, going to be a long relationship. I think that it's important for a PCP, again, primary care provider, to respect your time and to try to run on time. I know we all do our best to do that, but also understand that a patient in front of you may have had additional care that they needed. And also know that when it's your turn or in your appointment time, if that care is needed, as a primary care provider, we'll spend that time with you. But if you have a PCP that runs consistently late, they may not, that may be time to look for another. But it has to be a relationship where it's mutually agreed upon and a relationship that's mutual respected. And let me add, a provider that listens to you and not talks at you. So as a patient, I think that you need to know going in what is important to you from your PCP. And at that first patient appointment, did you get that? Because just because you saw them, if it wasn't mutually satisfying, you don't need to go back. You can find another provider.
Shelley,
Oh, sorry, Chris.
go ahead, Karen.
On that note, if I'm a new patient in your practice and I don't click with the primary care that gets assigned to me, am I able to switch to someone else within the practice, or is that something that you can't do?
That's a good question, Carrie, because there are a lot of rules within departments that patients really don't understand. If you were not discharged, which patients too, that's kind of another subject. I think patients are surprised when they find or learn that they can be discharged from a practice. But if it's mutually agreed upon, so what we generally will do, if you don't click with a PCP, but you may say, but my husband goes to Dr. So-and-so within your office, and he really likes her, can I switch to her? What we generally will do is especially if it's a new patient, there's not going to be any erosion in the provider relationship at a one-time patient. So we usually will allow that, but what we don't allow is bouncing throughout the practice. So a lot of practice practices will allow a one-time switch, but you can't just keep bouncing from provider to provider
Okay.
I
within
think
the same practice.
I think
Gotcha.
a lot of that too depends on what you're seeing. I know when I managed an OB-GYN office, if you didn't like one of our doctors and you wanted to switch to another, we didn't really allow that because you could end up being delivered by that doctor that you didn't like. So
Right.
there was no way to make sure that you didn't see that physician. You might, or you may have to see him on a sick call, if
Right.
the doctor wasn't in that day. So there's some variables out there. I just wanted to ask a question about physicians that traditionally run late. Okay. So I think that's a double-edged sword, primarily because the physician that runs late is taking his time. He's not in a hurry. That we're not here. It's not a sprint, it's a marathon. And he's not there to rush you in and out. So I think that some patients accept that and know that when their time comes that they will be treated the same way as the patients that were seen before them that day, that the physician is going to take his time, whatever time they need. So it's not necessarily a bad thing when
Right.
physicians run late, because this is dealing with humans and we're messy.
Right.
And
Right. Absolutely.
things come up. So I think it depends on the nature of the patient. If they're patient and they go there with the expectation, he runs late, I'm going to be waiting.
Absolutely. I have a large physician practice right now, and I have one that runs late all day, every day. But the thing is, the patients, as you said, accept that because they know when it's their turn, he's not going to try and make up that time with them, like cut it short so he can get back on time. He's just going to run late all day. And if you see him, he's going to spend all the time that you need with him as well. And also for new patients, don't be surprised. We schedule you 45 minutes. And that is because it isn't a sprint. We want to get to know you. We want to have appropriate time with you. So a new patient can plan on being here for 45 minutes. And I also wanted to back up a little bit. When you're a new patient and you're in that room with that provider, ask questions. You have the right to ask questions. Ask, how do you prefer I contact you regarding my refills? Ask, how do I contact you after hours if I need to? Prepare a list of questions and don't be afraid to ask them. It makes for a better relationship. Moving forward, or when you're in a situation and you need to contact that provider and it's after office hours, you know what to do then. So, you have a list of questions as well as a new patient.
Do you think there should be a limitation on the number of questions that a patient can ask?
No, not questions, because we allow for that time for 45 minutes, not questions. But I will say this, you may be asked to come back soon if you have a lot of diagnoses, a lot of problems at that new patient visit, because so much time is spent getting your history. You should come in knowing your family history as best you can. I know we all can't do that. So a lot of time is spent in dotting the I's and crossing the T's in that aspect. So if you have a lot of issues, you can expect that primary care provider to take care of the more serious ones first. Any heart, cardiac, or any cardiac, brain, lungs, are going to check out the important things first. You may be asked, if you're coming in with 10 complications, you can anticipate them saying, let's conquer this list a little bit as we can, and let's come back once we've ruled out all the serious things. Let's come back in a month or so. So questions we're okay with, but we may have to split the visit.
Okay. Yeah, because the reality is, and many people don't like to think of going to their physician in this way. It's a business too. And
Absolutely.
so they clearly, obviously, they have to pay their staff and their rent and their supply costs and everything else. And then we need to also remember that the insurance company only pays for a certain amount of that physician's time.
Absolutely. It is the business of medicine.
Right. And I know that a lot of people don't like to look at it like that, but it truly is. And not that we're there to make widgets, it's not like, okay, in, out, in that fashion, but you still have to be cognizant of their time and mindful of the fact that they have other patients they have to see that day.
Absolutely. But also, if you have a lot of issues, you don't want that physician or provider to rush through them either. So in order to do that, like I said, they're always going to focus on the more serious, but they can't do it all at once. There's a lot that goes on behind the scenes that maybe patients aren't aware of, and that might be referrals to specialists or providers getting on websites, looking up conditions, referring, consulting with their partners. There's a lot of behind the scenes that happen after your appointment regarding you as the patient.
You spoke to the fact that you allow 45 minutes for a new patient visit. Now, that new patient visit, is that a new patient physical? Is that dealing with all of their different acuities? How do you handle that? Because I know there's such a thing as a yearly physical, and then there are what we refer to as sick calls.
Correct. We tend to not try and mix a sick call within a new patient. Primary care focus is to keep you healthy and often to refer you to a specialist regarding your issues. But we focus on keeping you healthy, and those physicals are important, very important. We'll do a physical at a new patient appointment, but generally not a sick call, because we haven't established, we don't know you yet. We don't know your history. We don't know. It's generally not the time. If you haven't changed providers yet and you're sick, it would usually be recommended that you stay with your current provider and then schedule a healthy new patient visit. That's not always possible, and we'd certainly never turn anyone away if they couldn't do it that way. But your physical is very important. And again, the focus of us is keeping you healthy with vaccines if you choose to have them, but screenings and your yearly physicals, which a lot of patients put off because they think they're healthy. Well, what's the point of doing them? But that's how you stay healthy and stay in touch with your provider. Is at least, we prefer the patient at least touch on a yearly basis, regardless of age, acuities, or it's important to keep you healthy.
If I'm a new patient and I haven't seen you yet and I'm new to the area, will you refill my prescription for me?
If you have not seen us yet?
Correct.
No, we can't do that, because again, we can't, it's not best practice. If we have not had a face-to-face with you, we don't have your full history. We may not have your current history. We do get your records. And again, what patients may not realize is we read through those records before we see you, but they may not be current. You may have had changes. You may have been in the hospital. So that's just not a safe practice to refill a prescription without having seen the patient in person. We might offer you a telehealth appointment and say, if you absolutely, you can't get here, or maybe you have your appointment scheduled and it's in a month, but you live in another city, we would do a telehealth and try and work with the patient by all means.
Okay.
Yeah, that's fair. And if I'm coming in as a new patient,
How would, Shelley, if I'm, whoops, is it okay if I keep going?
Go ahead.
Okay. I'm sorry.
That's all right.
You can edit this out.
I got my questions here. I'm ready. I wrote them
Oh,
down.
she can edit.
So, Shelley, if I am looking for a primary care, how do I know if you're accepting new patients? How do I go about finding?
Well, that's a good question.
That is a good question. You can check on your insurance website, but here's the thing about that. They're not always up to date. There are several insurance payers that I can tell you right now historically their websites are so far behind as far as even whether they're in network. I would always suggest calling the practice, asking first, do you accept my insurance and are you accepting new patients? So I would speak directly to the office.
And then how would I know if I'm going to owe a copay on that first visit?
It'll usually say on your insurance card, it'll say the amount of copay, but anymore with EMRs the way they are, even if your copay doesn't, your card doesn't say it, when you come in, we run an eligibility check and it will tell us what your copay is. So we usually know at your check-in.
And that's expected at the time of your visit, correct?
It is because the No Surprise Act, which was spoken about in episode 1, you have to send an estimate to the patient and it has to be within $400, but same day appointments, not really applying to new patients. Same day appointments do not require that. So, but a new patient would.
Okay.
And remember, it's just an estimate, but it should be pretty close.
Yeah.
Well, it's helpful if the patient knows their benefits, and we know, and I'm as guilty as anyone, not really knowing what your benefits are, but it should be in the information that you receive from your employer if you're on an employer plan, what your copay, what your out of pocket is, and it is due at the time of service, and the physician practice expects to get that. They shouldn't have to bill you for that.
Absolutely not.
That's another expense added. And so they're trying to be as efficient as possible and keep their expenses down. So you really do need to pay that copay at the time of service. Also, at the time of service, when I come in and I'm a new patient, if you don't have records, what information should I bring to that visit besides my medication list?
Just always know what we can have you sign records here as well. Sometimes patients leave their old office, maybe not on the best relationship grounds, and you're uncomfortable or you don't want to ask for that. It's awkward to ask for a transfer. So there are times we don't have your records here, and we're happy to have you sign, and we will take care of that for you. But I would make sure that you try and have a list of issues you want to discuss, your family history, your medication bottles or list if it's possible. I would also always suggest, in most organizations, most practices, it's available, signing up on a patient portal, because if you don't have your records are accessible to you. And almost everything can be found there. All your visit summaries, which detail your past visits. So I highly recommend patient portals because you can access things at just, from your phone, from anywhere.
Does primary care need to know my surgical history?
Absolutely. Surgical history is very important. All of that play together, how we may prescribe, how we may refer, all of that information is necessary for a primary care physician to manage and partner with you in your healthcare.
Good to know. And then I guess we need to talk about, why is it so important to have a primary care provider, even if you're young and healthy and you don't have any acuities that need to be managed?
It is so important. A primary care providers is driving that bus. I mean, they are managing everything. And as I said, not to be redundant, but their focus is to keep you healthy. You may be healthy today, but who knows what next week brings? And you're not going to call and get in a day as a new patient. Some offices it's 6 months out. Or to get in, it may not be with the person you would prefer to get in with, but it's the quickest you can. You need to have one on record already for when those situations arise. Even if you don't have a situation, you should be coming in and getting your flu shot. If you choose to be vaccinated, you should be keeping current with those. And you could fall down and now you need a referral to a specialist and you don't even have a primary care doctor to refer you. And the thing is, even if you have a PPO, which is a preferred provider organization that allows you freedom to go to a specialist without a referral, most specialists nowadays won't see you unless you have a refer from your primary care doctor. You may say, but my insurance doesn't require this, but the office does. And that comes down to, again, payment and medical necessity, which is an entirely different topic. But even though you may feel you have the freedom to go to wherever you don't, the truth is when you call to make that appointment and they want a referral, you're not established anywhere. And again, it's going to take you 6 weeks to 3 or 4 months to get established. That provider, that PCP relationship is your go-to person. Unless you want to spend all your time going to urgent cares and floundering through different organizations, that primary care is a necessity.
Well, let's say I don't have a primary care and I'm sick and I call you. What is the chance of me getting in right away, right now, while I'm sick?
That is the answer to that one is it's gonna depend. It's gonna depend on how many providers I have out. It's gonna depend on the month. January historically is slower because of deductibles. There's so many things that come into play on that. It's hard to give an answer, but the chances are not great. We will do our best to get you in, but you most likely will, and you're sick, you most likely will be referred to urgent care and asked to schedule a new patient appointment and get you in. Primary care offices aren't urgent care offices. We're not those walk-in or, hey, I'm sick, can you see me? Which is another reason why it's so important to already have one. See your pediatrician until you age out and then get a primary care physician. That doesn't mean you're going to go there. We're not going to require you to come in every 3 months, 6 months. That's not going to happen, but you need to be established.
Do I need to come in yearly?
We prefer it, but of course we can't make you do anything. You are still our patient if you don't come in yearly. If you're healthy and 20 and you don't need us till 3-4 years, you are still our patient until you transfer out or are discharged or that relationship has been severed. So we would prefer it, but again, that would be your choice. We would hope that you would, but that's your choice. And most insurances pay for a physical yearly anyway. So if you have insurance and you're using it, you may as well get what it provides you. You're paying the premium, so the physical is generally covered.
I think a lot of people, and these are just people that I've come across in working in healthcare, feel that they don't have time to go to the doctor. They can't
we get that
miss
a lot.
work.
That's where telehealth comes in handy, but know that we can't do a physical with telehealth. Your insurance will not allow it. So that's one of the few visits that we can't do with telehealth. And your health deserves for you to carve out that 30 minutes time, especially if you chose a PCP that's convenient to your work or your home, so your travel time is less. And that's where you're going to want a PCP that is known to stay on time. But you have to make that time. And again, we'd offer telehealth where you can, but know that a physical can never be telehealth. We have to put a stethoscope on you. We have to examine you. So that is the one visit, the only visit where telehealth is not applicable.
But unfortunately, we know all too well there are the people that they really can't miss work. I'll frame it like that. They cannot miss just due to the nature of the job that they have. So therefore, they neglect their health.
Absolutely.
I think that it should never be detrimental to your employment if you have to take off for a doctor's appointment. Now, if you're self-employed and if you don't work, you can't pay your bills or whatever. That's a different situation. But if you're employed, it should never cause you any harm, discipline, whatever, to have to go see your doctor. I mean, if you're doing it monthly, that's something, but a yearly visit to your doctor, that should be something that they should expect. That's just my opinion. It's probably not shared by everyone, but I
In
think
that case, I'm sorry, in that case, find office hours that work for you. Find a place. A lot of physicians offer 2 days a week evening hours. We open at 7 a.m. to see patients. Half of the office does, so that those patients that work 8 to 5 can get that 7 a.m. appointment. If that's your situation, it is so important that you have this physical, or that you be seen yearly. Find office hours conducive to your employment. Know also that you can ask your PCP for a work note, and your employer should be accepting of the work note that, yes, you are at our office. But again, there's a lot of offices with evening hours.
does my health insurance know the office hours of the physicians that are in their network?
It's on their website. It's posted on their website. But again, they're not always current. When I looked up our website, for one thing, it had the wrong area code, but it also had our hours as 8 to 5, and we are 7 to 5. So again, do your due diligence and maybe make that phone call to say, and that's not to say all websites are not. Look at the websites, find one that has late hours, and then and the office hours are posted on a lot of websites. If we contract with, let's say, Aetna United, our hours are often posted on there. It's just a matter of whether they're accurate or not, but they are posted. So when you see an office that's suitable to your needs, then call that office. Never assume it's correct. Call that office and ask if they have evening or early morning hours. We're also amenable to seeing a patient during lunch hour if they have to. I mean, once you establish that care, and I know we're talking more about new patients, most of the primary care world, I can't say that because I'm in our office and the offices I manage, which I have more than one, we'll go out of our way to see you. We want to see that patient. So if it means us working through lunch, we're more than happy to do it.
That's good to know. Because not everybody is amenable to that.
Right.
And I think maybe that should come into play when you're making your decision as to who you're going to have as your primary care provider, and along with the fact that this is going to be a long-term relationship, unlike some specialties where you may see them a few times unless you have surgery,
Yeah.
and you're done. It's you're going to see that doctor for years down the road, and you want it to be a good relationship, so you want it to be someone who can accommodate your needs.
Absolutely. And you have a voice. You really do. A lot of organizations. So when I first started in this practice, the hours were 8 to 5, and that was it. And some of the survey comments were, we wish you had more early morning or evening hours. So you do have a voice, and we do read those comments, and they're important. And so I heard it enough or read it enough, that half the office went 7 to 4 and the other half of the office went 8 to 5. So know that when you get these surveys, or when you have a suggestion, we do listen to those. So don't be afraid to speak up.
Shelly, about how long, if I'm going to go see primary care for the first time, about how long before I would be able to be scheduled in once I make the call to an office? And I know it varies between offices, but for instance, in your office, do you guys try to accommodate within a certain time period, or is there a goal set for most offices to try to get that patient in relatively quickly?
We do. What I do is, you can almost always get in with a nurse practitioner relatively soon. Some that are waiting for the physician, though. So what I do is I track next available and third next available. So there's metrics that go in behind it. And when I see that we're getting too far out, I go into the schedule and open it up sooner. So you may call and they say, and then I also keep a list. So you can keep, most computers, most EHRs can keep a running list. So if your appointment, let's say with one of the physicians here, is 5 months out, because we've gotten to that point where it is 5 months out, we open up new. Know that you're on that list, whether you chose to be or not, and we will try and call you sooner and start working new patients in sooner when we see that they're piling up. But realistically, you can anticipate a minimum of 6 weeks for a physician in most offices. That's just standard. And I think that probably most patients would be surprised to hear that. I think they anticipate being able to call and get right in, and that's usually not the situation. Often when you had said about a sick call with a new patient, we might put them with the nurse practitioner and then try to get them to the physician that they choose, if we can do that. But most PCPs are in demand right now. There's not as many locally here anyway as there once was. It used to be very saturated and it no longer is. So I would anticipate 6 weeks.
Well,
Okay.
can I just say that if I want to see someone and you tell me I have to wait 5 months, I don't know that I really, as a patient, I guess in my mind, I think then you don't really need me as a patient.
And that's a fair assumption. Most of our patients that wait that long, it's because they're waiting for a specific, my family sees this person, my so-and-so sees Dr. Smith, and I don't care how long it takes, that's who I want to see. So they stay with their current practitioner until that appointment time. It's not like they are going without. Now, I know if you're new to the area, that's a separate issue and can't do that. But the scenario with that is you are waiting for a very specific provider. Otherwise, there's always somebody we can get you in with. And when a patient cancels, we're on the phone first trying to move up the one that's scheduled out the furthest so that we can be fair and get them in the soonest. But I totally understand that, but they may call 5 offices and no PCP can get them in sooner. It's not specific to, let's say, my office or the office across the parking lot. It's that way at times. So I think as a new patient, try to prepare. If you know you're moving to this area, if you know you want to switch, be prepared and schedule early.
That's good advice because I don't think people realize that.
It's and it's hit or miss. Again, it depends on the month. It depends on what's happening. The season, is it a season of sickness? Is it, we try and save those spots for new patient appointments. But physicians and APPs with full patient rosters, at some point you're going to release it and start filling it. So there's not a gap in their schedule, but we do hold them for a certain amount of time. But unfortunately, I think the patient expectation and the reality of getting in for a new appointment aren't the same, because the reality is it's going to take you a while.
Sure. Can we circle back a little bit to the importance of the primary care? I think you kind of touched on it a little bit with when you talked about, if you go to a specialist or whatnot. So that primary care, Shelley, can you talk a little bit how I always think of the primary care as they kind of are they know everything. Not that they know everything, but they kind of have an eye on everything that's going on with me. So if I do go to a specialist, I would I always put my primary care down to get the results as well as the specialist or something like that. So that the primary care has the overall picture of my health and can look at making good recommendations or decisions about my health, having that whole overall view. And I think that's one thing that I don't know if people kind of get in that point of contact I don't know if you can elaborate on that and the importance of that.
It's crucial because if you don't have a PCP and you're seeing all this specialist, who's wrapping it up and tying it up with a bow? Your PCP is. So you might be on all these different medications from all these specialists. If they're not in the same organization, they don't share the same electronic records. One hand doesn't know what the other hand's doing. There's too many cooks in the kitchen. Your PCP manages your care. That is who manages your care with the help of, again, a partnership with you. But your specialist, he gets all the reports from the specialist. He knows what your status is at all times. He or she is generally never going to see you in the hospital. You're going to get a hospitalist, but we're going to get all those records. If you are admitted to a hospital without any PCP, the first thing they're going to tell you, the very first thing on discharge is follow up with your PCP. And if you say, I don't have one, we're right back in the situation we just spoke about, which is you're waiting six weeks to a month, 2 months, 3 months to get one, and you're now in a situation where you need one. That PCP is the overseer of all your health, not just trying to keep you healthy, but any issue with the specialist, he is corresponding everything, whether it be your labs, your imaging. He or she is looking at, reading, viewing, following up on your health. And every time you see a specialist, they're going to say, follow back up in 10 days with your PCP. So they are just like the nucleus, so to speak, of everything regarding your health care, big or small.
Yep. You know, speaking of that, being in the hospital, Carrie and I touched on this last week, that a lot of primary care doctors don't round at the hospitals anymore. So if your providers do not round at the hospital and they get notified that I'm in there, what do they do? Do they oversee that? I'm going to be seen by a hospitalist that doesn't know me at that point.
They are going to get your records, especially again in the age of EMRs, and you're seeing a PCP that's part of an organization. We can see those currently up to date. I mean, as things happen in real time, we're getting those records, reviewing things. We're not really managing your care in the hospital. That is up for the hospitalist to do. But again, we're reviewing all correspondence, and there's been times where a PCP has reached out to the specialist, or the specialist has reached out to the PCP to question. It's more the specialist reaching out to us to question things, whether it be medications or history that may not be complete because it wasn't completed, you didn't know it maybe at the first visit or whatever. But they do work, we do follow you. So just because we're not seeing you doesn't mean we're not keeping up with what's happening to you. We have a care navigator in our office, and if you're discharged from the hospital, she sees that as well. Any hospital, whether it's within our organization or not, and chances are she's going to be calling you in 2 days to say you need to come back into the office and follow up. So the nice thing about that is you have somebody, when you have a PCP, you have somebody looking after you, looking after your care, even when they're not seeing you, if that makes sense.
Yep. Yeah, that does. Good to know. Because I think so many people just don't understand the importance of having a care team and how it all works, how it's interrelated. And
when you and to circle back to what to bring to a new patient appointment, you just said something that I forgot to add, which is know all the names of your specialists, because we will stay in contact with them. So bring your med list, but also bring any specialist name that you see, because that is part of your care team and we need to know that.
Good information. We could probably talk about this all day.
Yeah, the time went quick.
I told you it goes by fast. And there's more topics that I'm sure we can discuss at a later date. But just in wrapping this up, we want to reiterate to anybody out there that the importance of having a care team. the importance of having a primary care provider that has a relationship with you, that knows you.
Yep.
Absolutely crucial, because when you say care team, your PCP is the captain of that team, and I don't care if you're 20, I don't care if you're 70, you need a primary care physician. There will come a time when you need them, and you should be established with one.
Exactly. Good information. And thanks, everybody. This was great information. We'll be back again next week with the next episode of When Is It About the Patient? Thanks so much.